In the survey of doctors that we've just completed, we found that about 1 in 4 of the doctors were not convinced that the government's proposals would have a positive impact on patient care. So it's obviously, quite concerning. I think, but more positively, particularly for the government thinking about the implementation of the white paper proposals, is that about 60% who responded thought that there were GPs in their area who could take a lead in the commissioning role. It does appear that doctors are somewhat sceptical about the impact that the reforms are going to have. We asked them as well who they thought the reforms would empower. The government's hope is that the reforms will empower both doctors and patients, but actually the majority of doctors were quite sceptical about whether it would empower either patients or doctors, and certainly very few people thought that it would only empower patients. There were quite a few who thought it to some extent it would empower doctors, and in particular a number mentioned specifically GPs. I think it also suggests that they're somewhat sceptical about the impact. We did ask about the impact on public health and health inequalities. One of the key proposals is moving health improvement and public health to local authorities. The doctors that we surveyed seemed to think that this wouldn't have a beneficial impact on improving health and reducing health inequalities. I think ministers can be positive that clinicians do believe that there are GPs out there who have got the capacity to take on the new commissioning responsibilities. But I think they also need to recognise that there are going to be some pretty serious risks in the implementation phase, which is so dependent on getting doctors engaged. Our survey suggests they don't believe that these are going to necessarily have a positive impact on the patient care that they deliver in their organisations and practices.
Well, this survey has highlighted that doctors as a group are pretty sceptical that it's possible to improve efficiency at the same time as implementing these proposed reforms. But the good thing is that doctors recognise that by communicating and collaborating across primary care, secondary care and public health, that some of these things can be addressed and efficiency can be improved. The results of the survey do reflect what doctors are saying on the ground. For instance, in the Doctors.net UK forum, doctors from all walks of clinical life are saying they experience inefficiency, wastage and poor patient experience. And this new area is really a challenge for doctors to take the lead into identifying areas where there can be improvement to ensure that the NHS moves forward in a way that is more efficient and delivers better patient care. I think there's one very simple thing that the government needs to do, and that's to communicate, ideally directly with doctors, to allay fears, to fill in the gaps that are still there in terms of the detail, and most of all to be completely open, because I think doctors are somewhat cynical and sceptical that they've experienced in the last few decades quite a few changes, and they want to know that this one's really going to make the difference.